Welcome to Survey and Beyond, the data collection podcast by Survey CTO. We share expert insights and practical tips on data collection and analysis, discuss innovative methods and tools to enhance data quality and security, and demystify complex data concepts to help people collecting data all around the world. I'm your host, Marta Costa. Joining us today is Paul Nzerebendev, the Decision Support Analyst at the Human Trafficking Insititute in Uganda. Paul brings a wealth of experience in building and optimizing data systems that drive strategic decisions, enhance organizational visibility, and foster impactful partnerships. With a strong background in monitoring, evaluation, accountability, and learning, Paul has held pivotal roles at organizations such as Nyaka and Raising the Village, where he developed robust data collection frameworks that transformed how these organizations deliver services and operate their programs, leading to great impact and sustainability. Paul has also played a critical role in mentoring development professionals across the Global South, helping them to navigate the challenges of data management and to leverage data for advocacy and funding. His work has consistently focused on ensuring that data collection not only reflects community priorities, but also serves as a powerful tool for driving equitable funding and sustained growth. With a deep commitment to using data for social good, Paul is a leading figure in the intersection of data, development, and human rights. Welcome, Paul.
Yeah, thank you. Thank you so much. I'm so honored. I'm so glad. And you know, Marta, I'm always humbled to have conversations about data, about impact, about how we can use data to transform communities. So I am so honored, and this is yet another opportunity for us to have these conversations. Thank you so much.
Thank you. And it's always a pleasure to speak with you about these topics. So I really wanted to kick off the conversation to explore your personal journey, because you always speak about data in such a passionate way. Do you still remember what sparked this passion?
Yes. So I joined the profession of data in 2011. I started as a banker. You know, I worked in commercial banks in Uganda. I was working into the investment department, extending money to people to do investments, loans, and others. But along the way, I met so many organizations that needed my support to do with data analysis, provide support with data for strategic planning, provide support with data for reporting. And then in 2016, I realized as a statistician, I needed to move away from banking. I'd learned enough banking, I'd learned microfinance, and I felt I was done with that field. I joined NGO. When I reached in the NGO sector, in my first organization, Raising the Village, the challenge of data was evident. We were using paper to collect data. I remember my first tool was a paper-based tool. And you know, we would tick what we want. And then later we get computers, we enter into Excel. And you know, it was tedious, it was hectic. But 1 year later, we discovered Survey CTO. We piloted Survey CTO. And I didn't look back. Along the way, I've understood, I've grown passion for data. I've realized that data is a game changer. Data elevates communities because it brings out the best of them. When you're doing a program in a community and then you're collecting data on them, you're able to demonstrate how a community can transform from one level to another. You're able to demonstrate how an individual transforms from one level to another. Let me give you an example, Marta. A clear example is a community, a village of 100 households, which are generally poor, surviving on less than $1 per day. When you start providing interventions that aim to elevate their income from $1 per day, maybe to $3 per day in a period of 3 years, you start collecting data right away from baseline. So you program your questions, and then you put them in Survey-City, or collect your data at baseline, then continue intervening, provide solutions. After year 1, go back and collect the same data. After year 2, do the same data. After year 3, collect the same data. Amazingly, when you've done that, you'll begin seeing a change in incomes. You'll see an increase from $1 to $2 to $3 to $5. This is what I've been doing for I think 7 years now, using data to demonstrate impact, demonstrate change, and eventually using it to tell donors that, hey, look, there's where you can invest money and see real change. And that's how we continue measuring returns on social returns on social investment and others. And Martha, that has been my life. I've worked with Raising the Village doing the same. I've done it with Nyaka and very many other organizations that fund these other local organizations, but I'm also doing it with the Human Trafficking Institute. And at the bottom line, the key outputs are: have your data collected in real time, analyze it properly, store it properly, write good reports, and then become visible and findable by people who are supporting this work. That's it about me, Marta. Thank you.
Thank you. Thank you so much. So, and after so many years of working with so many organizations and helping them on using data and being more visible, what motivates you now on continue doing this work? Is it mostly the social impact that you have been witnessing over the years?
What has motivated me is my motivation, I would say, stems from the tangible results I've witnessed when data is used to demonstrate impact. I feel so happy when I use data to demonstrate that a certain classroom of children who are in a community down there is improving in performance. They have improved from when they were enrolled. The way they do mathematics has been improving from 30% to 40% to 60%. That kind of progress gives me hope that data can actually communicate change. The other motivation is me seeing how data actually results into targeted interventions. In Raising the Village, in Nyaka, where I designed the electronic medical record system, the system evolved into a project that caused Nyaka to start designing specific projects. For example, we recently, in 2023, towards the end of 2023, because of that system, we identified peptic ulcers as a common disease among the people who are aged 60 and above. And as a result, we initiated a nutrition program tailored for them. How do you feel knowing that you designed the system, it realized a problem, and now there's a solution and someone is willing to fund it? That keeps you going. And these are the things that are motivating me. Let me give you a last example. With Raising the Village, when we were collecting data on WASH, water, sanitation, and hygiene, you go to a community and you measure their compliance and adoption to best practices on WASH, and they score 10% or 5%. Then you roll out interventions that are aimed at helping them improve their WASH programs. You begin collecting data every 6 months. At year 3, communities which were scoring 5%, you begin seeing them scoring 80, 90. But it's not just data communicating. You begin seeing improvement in WASH. You reach a home, it's clean, they have water at the toilet, they have clean compounds, and you're like, wow, data is guiding us to do amazing things in communities, saving lives and improving them. These things keep me going and working so hard and innovating a lot of data initiatives.
That feels very rewarding. So I can relate to your motivation. And I wanted to now explore a bit more about your work, but for our listeners that might be new to the field and might not really know a lot, would you be able to start the conversation just giving us an overview of the organizations and the projects that you usually work on? I think you already shared a few examples. Let's just offer a good overview to our listeners.
I'll concentrate on 2 or 3 of the big projects that I've worked on. And I'll keep using organizations which are familiar with everyone: Raising the Village, Nyaka AIDS Orphans Project, and the Human Trafficking Institute where I'm working. 3 things that I've cut across all the 3 organizations where I've worked from 2016 to date is ensuring that data is collected using digital tools and then being transmitted to a dashboard that is accessible within the organization, and then using that data for continuous learning, measuring progress, but also demonstrating impact of the program. These 3 have been constant across the organizations where I work from. And amazingly is that when I joined Raising the Village, I pioneered the process of digitizing every program that we are doing. I did the same with Nyaka, but also with the Human Trafficking Institute. I'm redefining how we see data from human trafficking crimes. And Marta, the projects that I'm mentioning here are projects that encompass programs that are multi-sectoral. For example, in Raising the Village and Nyaka, the programs were education, there was health, then there was the livelihood program, including microfinance, but also other programs on sexual and gender-based violence and human rights. So we are talking of a complex program that streams data from multiple sources. In a real sense, it should be difficult for you to collect that data, to centralize it, but also analyze it when you don't have a digital data collection system in place. But what happens with Nyaka, Raising the Village, and the Human Trafficking Institute is that at the start, we map out a data collection system, and usually using SurveyCTO as the best mobile and offline application app. It has been a game changer for me because I'm able to design what I want. I innovate what I want. If I want a medical record system, I create it. If I want an education monitoring tool, I create it. Whatever I want, I modify. If I want a microfinance tracking system, I create it. Then I put it on phones. Regardless of how many staff we have, then if they are 100 or 200, everyone will be sending data to the same system and from anywhere. The hard-to-reach areas in Africa, in sub-Saharan Africa, especially in the global south, have caused us to continue thinking outside the box. And I'm glad SurveyCTO has moved this journey with us, that you can collect data from a mountain or an area that has no internet. And at the end of the day, the data will be sent through cloud, and then everyone will have it on their system or dashboard. These are the projects I'm building and I'm emphasizing and advocating for every organization. Have it capture data from anywhere and across all programs, then build out a system that brings it to a dashboard. And SurveyCTO allows you to transmit data through connections like Google Sheets and other APIs, webhooks, and then gives you a chance to actually use dashboards like Google Data Studio, Power BI, Tableau, and whatever you want. And through the dashboard, you're able to analyze it. Doing that saves the organization about 90% of the budget on data collection, analysis, and digitization, and all those things go away. The quality of data becomes unquestionable. All the dashboards we create for all the organizations I've supported stream live data. We don't edit this data. It's live. Why? Because when you're organizing a digitized data collection system, you put quality checks, but also you control it. If it's gender, you want male and female, M and F. If it's age, you say don't exceed 100. We are not dealing with people who are above 100. If it's money, more microfinance data, you don't exceed a certain limit. So the data is clean, and these are the projects I'm working on, Marta. And in the end, once we've set up a result-based M&E system, there's one thing left. The thing that is left is to measure impact. through heavy surveys. These surveys, we design them using statistical methods, but also advisory from people who have done this over and over. And once you do that, it means you're having data from the field. Monitoring data is available, input data is available, output data is available, outcome data is available, and then impact data is available. And once you have all these digitized and happening in real time, then you sit down and ask yourself the what question, the what next question, which is, how do we now demonstrate impact? How do we communicate this? How do we now use this to be findable and fundable? In a nutshell, those are the projects I'm working on right now for all the organizations where I am.
That was a perfect overview. Thank you so much. So you mentioned a lot that when you started working for Raising the Village, you were relying a lot on paper-based data collection. And now you transition to a more digital data collection process using Survey CTO. I'm wondering if there were any other significant shifts other than the technology that improved data collection workflows over time.
Yeah, I confirm what you've just said and what I said before. Over the last decade, there has been a significant shift towards digitizing data collections. And many organizations have now realized that you can use Savestio, you can use ODK, you can use COBOL to collect data. But there's also a shift that I'm seeing in using automated reporting systems where data feeds directly into dashboards that track data in real time. But also these dashboards are programmed to provide analysis, the percentages, the averages, the differences, the heat maps, and the rest. But there's another shift I'm seeing in the human resource. Previously, organizations have not been having the monitoring and evaluation departments where the data guys sit. But now I'm seeing a shift. Organizations are adopting M&E departments and systems that house all this data. And that is causing a lot of skills programs, training programs, and a lot of benchmarking for organizations. The other shift I'm seeing is availing data for M&E. Every organization I've worked with, I've advocated for funding for data collection. I never allow a proposal to go out to a donor without a budget for M&A and data. Why? Because we can no longer ignore data collection. And I don't just advocate for data collection, but including even software. All my annual budgets and proposals to donors advocate for purchase of software, Survey CTO software licensing, and other tools that are meant to help us have data. So these are shifts that are going to happen even in the coming years. But also finally, because people now understand that data is now vital and critical for organizations, they have introduced AI to further make it easy and efficient. I've recently seen Savestio has adopted an AI component. I used it recently to frame out some questions and answers. And what amused me is that Savestio did not only just create an AI solution for drafting questions and data collection questions, but you also code it. And you're simply telling me, get this code, go and upload it in Savestio and go to the field. These are shifts we're going to see in the next decade or so, and they're going to be a game changer.
Thank you. That was quite helpful. And I would love to hear more about specific recommendations and advice for how organizations can adapt to those shifts and those new challenges and opportunities. But maybe before that, I would love to dig deeper into a specific successful story that you have to share. You speak a lot about how it is important to collect high quality data, but also to use that data to better communicate the impacts of organizations and to help them grow and sustain funding. And I'm quite aware that you played an important role in Nyaka at building their annual impact reports. So I would love to lay down with you today. How was your process in designing these impact reports for Nyaka, so that we can potentially, hopefully, inspire other people in other organizations to better communicate their data and potentially be able to get more funding out of it? So can you maybe explain to us Nyaka and describe your work in Nyaka?
It was a journey, but I would summarize it in like 3 ways. One, identifying the data points at Nyaka was so important. The data points that we needed to focus on. We tied them to our theory of change. We also created an M&E framework that aligned with those data points. Then we aligned everything to the mission, vision, and the goals of the organization. But in the end, we aimed at ensuring that the data we collect is acceptable within the communities. It also meets the ethical needs of the community. The stakeholders are comfortable with it, but also it's available within the program, but also within the beneficiaries that we were working with. This was critical because you can collect wrong data and then fail to use it. But also, you might want data which doesn't exist. Either it's not part of your program or it's not available. So planning that out was so important. Then number 2 was gathering all this into a way that would reflect in a data collection tool. And because we chose SurveyCTO as the data collection tool, we ensured that we are able to code it and program it and deploy it on our phones. Testing all this was so important because it helps your staff to adopt to the tools. It helps everyone to be online. And I did it when I was creating the electronic medical records for Nyaka as a case study. The process was the same. Collect data that is available on patients. Seek out stakeholder consent, seek out stakeholder harmonization. And this time our stakeholder was government. Government permitted us to use their data management books. And this was so important. So configuring all this was in harmony with government, data standards, but also the ethical considerations of data and the rest. There are things we continued considering, things like having unique IDs for every beneficiary so that we tie their data on their ID. But also the ID helps you to enhance confidentiality because you want that on your dashboard, someone should not use a name, but they should use my ID. If you don't know my ID, then you don't know me. And an ID usually is a combination of characters, which may be hard for someone to cram. But also, as we continued designing into the SurveyCTO system, we ensure that we have a dashboard which reflects the same. So this whole build-up positioned Nyaka and the clinic department to have data all the time, data that is well organized, data that maintains the ethical standards and guarantees confidentiality and privacy. When we had done this, we sat back and asked ourselves, but now we have data on our screens, we have data coming in, and it is organized. And the question was, what do we do with it? So we started building out specific key performance indicators. I gave an example of where we are monitoring the disease prevalence among grandmothers and men aged 6 and above, women and men aged 6 and above. And that's how we identified peptic ulcers as a dominant condition for them. And once it became dominant, we then wrote a proposal about a nutritional program and a training program that would address that challenge. It's now 1 year, the program is running, and we are seeing a downward trend in that condition. I could give you more examples like this over and over. But then at the end of the day, we have enough data to use for day-to-day operations, for program refinement, for improvement, and for doing resource mobilization like I've just mentioned. And we are doing it for children, grandmothers, we're doing it for women and others because our data shows trends on every age. Then in the end, at the end of the year, we ask ourselves, what impact are we seeing? Are we having impact on household income? For every patient who has come here at our clinic 5 times, How much have they paid? They have paid 10,000 Ugandan shillings. What if they had gone elsewhere? How much would they have paid? They would have paid maybe 50,000. How much have they been able to save in a year? Maybe 40,000. That becomes part of our impact. With Nyaka, this is a live example that I would give where I've seen data having impact on how we communicate results, of how we present them, how we mobilize for resources, how we advocate for communities, and then how we communicate impact.
So, Paul, was that a gradual process in the sense that you first built a data collection system to help Nyaka on their day-to-day operations, to help build the electronic medical records, to help the nurses, to help your medical staff to track your patients' data, and then from there you moved to defining KPIs that are helpful for resource mobilization and for program design and even for impact? Or were you able to plan all of these all at once in advance?
We thought it important to plan the process in advance. Actually, we documented it. We envisioned an electronic medical system that would do everything that I've mentioned. So we documented it at every step of the way. We envisioned the KPIs, we envisioned the M&E mapping, we envisioned the data sources and the data types. We also created the questionnaire replicated from the government health data management books. All this was created in advance. When paperwork was done or documentation was done, we now embarked on implementation. Our implementation was phased. We knew that designing a system takes time. It took us a whole year to actually confirm that we have the final product. We made sure that within a period of 2 months, we have designed the system and it's uploaded and deployed and it's working. However, we used the other 10 months to refine, learn, improve, and also modify our data and also enhance it as we deemed fit. So I would say that the heavy lift was on documenting the process, then using 2 months to design the system, deploy it, train our staff, and then they start using it. Then the 10 months to now look at the data and learn from it and continue refining. The following year, we confirmed that we have a project, and then we started talking about it. And now we continue to talk about it, and it has stabilized, and we are looking at people adopting it. Some have done, but we continue advocating that other people can adopt it along the way.
Perfect. Can you enumerate the main challenges that you faced throughout that process?
Yeah, the challenges that we continue to face as we do digital systems. Of course, it's evident that sometimes because the NGO space or the business space is generally formal, and also the space is not so tech savvy. The technology is so much driven by developed countries and maybe major urban places in developing countries like Uganda. When you talk about technology in a rural place in Uganda, in southwest Uganda, in Kanungu or Kunjiri, deep in the communities, they are health workers, they are organization workers, but they don't embrace the technology. And if you want to roll out the technology to the communities, it's even worse. For example, if you want to do telehealth in a community that is rural, people don't have smartphones. It leaves you to a point whereby you have to recruit teams to always look out for the data. It could be through the phone calls, but also it could be through visits. It becomes expensive to have data, yet the community would possibly be transmitting it through their phones. For example, you deploy a questionnaire on how they are feeling about their health, and then they have it on their smartphone, and they can always send you data on your system, and you see it. But it's the other way around. People don't have phones, they are not digital. Organizations continue doing the data collection the expensive way, even when technology has come. The other challenge I would say is that in as much as efforts have been put in place to make sure Organizations are embracing digital data collection and improving decision making, improving impact reporting, but also improving their resource mobilization and reaching out to donors and supporters and well-wishers. Organizations still find a challenge in recruiting the right human resource. There are not very many Pauls out there to be hired, but also those who are hired, many of them may not be so technical. They may not understand this whole process. It takes time to have a very good monitoring and evaluation person who understands these processes, who can figure them out, and then use them to bring out the best. But also, some donors are so powerful that they influence organizations in a way that is not efficient. A donor will tell you, if you don't provide data on a specific condition, I'm not going to fund you. And yet the organization does not deal with that specific condition. A donor will tell you, for your education program, I only want to pay school fees for girls who are aged maybe 20 and above. And yet the program is meant for all girls, regardless of their age, and all boys, regardless of their age. So donors are kind of antagonizing organization missions. They are antagonizing organization visions because they are powerful, they have the money, and that's one of the challenges most visionaries in developing countries are facing. And I wish podcasts like this can throw more light on the philotherapy world to be more sympathetic and more accommodative. Every philotherapist should be understanding. Don't impose needs on organizations. Be accommodative, negotiate with them, fund them knowing that they will improve over time. Fund them knowing that they are doing their best to serve communities, but don't impose and tell them, if you don't meet these conditions, we're not going to fund you. So the challenges are enormous, but those are the key ones that I could highlight out right now.
Thank you. On those notes about donors, how were you able to find the balance between, when you were creating the impact report, how were you able to find the balance between what donors want to see and also what resonates with the local communities you are serving, and other important stakeholders for you?
One thing I've learned is that donors also learn. As you do your work, they learn. When you show them that you are transparent, you're honest with your impact reporting, sometimes they'll compromise. They'll say, okay, based on the effort we are seeing through your impact report and the level of progress and the level of impact you're achieving, we are going to adopt what you're doing. I've seen donors in Nyaka, when I was with Nyaka and raising the village, donors were giving us open checks to specific impact reports just because they are impressed by what they are seeing. The publication of Nyaka 2023, the impact report, one donor wrote a check of 50,000 on grounds that we highlighted that the children had improved their level of spirituality within the community. They were aiming to be more spiritual than they were the previous years. So this Christian Foundation just said enclosed the budget is a check of 50,000. Use it to promote spirituality among the children, just because we highlighted it as an addition to their need. So donors are learning that it's possible to fund organizations like Nyaka through impact reporting when the impact report is honest, it's accurate, well estimated, but also it's demonstrating what communities actually need. But the second thing is that donors, in as much as they may want to drive you to a direction that they want, it's good that you keep negotiating with them, help them understand what you're doing, but also use data to actually show them that your program makes sense. The dashboards that have been designed by me and my organizations where I've worked, we've made some of them public. For example, if you go to a website called tipmap.ug, it shows you the dashboard for the Human Trafficking Institute in collaboration with the Office of the Prosecution of the Director of Public Prosecutions in Uganda. That dashboard communicates non-personal identification data on human trafficking. When you make your data public, to a donor. The donor will begin seeing through you what you actually want to achieve. Dashboards are one of the ways you can do that, but also making your data available for them to learn through. It eases the negotiations that you would have with them. But also finally, organizations like Savacity or the African Visionary Fund and other advocacy organizations have become the go-between for organizations that are having such challenges and those that are powerful. These organizations use advocacy means. For example, Savacity, you've had very many webinars that are calling on stakeholders and donors to actually relax the way they are funding organizations, but also to learn from organizations. And that way, this advocacy is having impact. It's also bringing more funding in Africa and Uganda and East Africa. And I think it's the way to go.
So it does seem that making data accessible and creating dashboards is a powerful tool, especially to speak with donors and other important people. Do you have any specific recommendations on how to create a powerful dashboard? What are the types of data visualization that people want to see or that are more memorable in a way?
I think creating a powerful dashboard for a specific program depends on what you are actually trying to achieve. But I'm also aware that there are specific indicators that every donor would want to see on a dashboard. The other thing about donors is that a donor may fail to fund you because they don't understand your program, either because you're presenting data in a complex way and you're not able to break it down into a layman's language. When I'm writing my impact reports, the key focus is always make it easy to read. I understand that human beings don't spend so much time reading. They will only read the first 2 pages and then their mind will become tired. Make it easy to read, design it well, give it a very strong graphic and keep it as simple as possible, but also integrate it with reports and success stories, integrate with photos, if possible, do a video, do the same report in very many formats so that you capture everyone's attention. Those who can do videos will read the slides. Those who can do slides will read the PDF. Make it available in various formats. It's the same with the dashboard. A dashboard, everyone would want to see if you are running a health program in Southwest Uganda, in a village in Southwest Uganda. On the dashboard, they would expect to see how many people you're serving every day because they want to know the reach of your program. So on your dashboard, you will need to have things like how many people are we serving every day? But they will want to know, are you serving women? Are you serving the youth? Are you serving children? Are you serving men? Or you're serving the elderly? Of those you've served on a daily, how do you categorize them by gender, by age, by their demographic location, and the rest? So all these are things you need to think about when you're creating a dashboard. The complex analysis of how are we seeing a shift in maybe a certain condition or a certain variable, those can come in, but they are the basics which you must have on your dashboard. The number of people you're reaching on a daily or on a monthly or annually should be on your dashboard. The disintegration by age, by gender, and by specific variables of interest, they must be on the dashboard. For example, if it's health, you must show like the different conditions which people are suffering from. It could be malaria, it could be HIV, it could be, you have to show those. But also, like I mentioned, you have to distribute them by the different categories of people that you're serving. If it's a condition on human trafficking, if it's a dashboard on human trafficking, there are things people would want to see. How many cases of human trafficking are being recorded every day in a country or in a region or in a district? They would want to see how many are females, how many are males. They want to see what kind of trafficking in persons cases are you having? Is it is it sexual? Is it labor exploitation? Is it both? They would want to see how many are children, how many are women, how many are males, how many are old. All these are things that donors would want to look out for. And then when you go to have conversations with them, you can now dig into the details or the complexities of the problem. And these complexities, when you're presenting them, have some success stories with you. Have some compelling photos with you. Have case studies which are documented with you. Think of testimonies from victors, from people who benefited from the program. Think of testimonies from staff, stakeholders, and the rest. When you combine all this with your dashboard data, you make a powerful story, you make a powerful impact story, you make a compelling case for someone to pay attention to what you're doing. But also it's important to invest time and space and resources in how to write. Writing is very important. There are very many people who are writing to very many donors. Donors receive thousands of applications every day. If you write normal things, if you write basic stuff that is not compelling, stuff that is not telling the actual problem on the ground, the donor will put it aside for someone who is writing and communicating well. Keep it simple. Don't over-repeat yourself. Be direct and highlight the problem as it is, but also be organized. All these contribute to impact reporting, resource mobilization, being findable, and being fundable. It's a whole complex process, but it's doable and people are doing it. I hope someone can take this podcast and then break down all these things, do more reading about them, but also they can reach out to Diversity or Ability, Marta, they can reach out to you, or they can reach out to me or any other person out there that can support them break this down for them.
For sure. Thank you. I think those are wonderful tips. And I wanted to make a connection between what you just said and some of the challenges that you mentioned before. And not only the challenges, but some shifts that you have been witnessing. Because you have mentioned a lot that new technology is coming, which is bringing opportunity, bringing challenges. So I wanted, before finishing this interview, I wanted to get your insights on how can organizations adapt and what are the practical skills they should be investing in to leverage the usage of their data. And you just mentioned one thing that I thought it was super important, which is invest in writing skills. It's quite important to know how to write their story. You mentioned that a lot of organizations are not tech savvy, so I would imagine that investing in technical skills on how people can start learning how to use important tools is very important. Do you have any other practical tips on that?
Yes. I'm just going to emphasize before I give something else. It's important that for every data you collect, you have to keep it simple, but be transparent and honest with your data. Be consistent and make sure that your data is clean. And like I mentioned, all these provisions are within the data collection tools or systems like Diversity allows you to do that. Diversity will allow you to keep your data consistent, but also it helps you to keep it simple. If you're not sure of how to keep it simple, I know the AI button of Diversity can support you with that. But the other tip about data and how to make it efficient is that whenever you're dealing with data, always ensure that you have documented out a map of how your data will flow. And by the map, I mean, make sure you have an M&E framework that shows what data you're going to collect. Make sure your map shows when the data should be collected, how you'll analyze it. Is the outcome of the data going to be a percentage? Is it going to be an average? Is it going to be a statistical outcome? Whatever it is, have it documented. Then explain it. You're creating a legacy that even when Paul leaves Nyaka or lives raised in the village, whoever comes after me will not find problems implementing what I've started. I should not leave an organization as an expert and then the entire data process crumbles down on the organization. The other thing about documenting is that when you're documenting, you're creating templates or what you call prototypes for guys who program. This prototype remains in place. So when writing the next report, you simply edit the numbers and maybe the stories and the photos. That way you become consistent You don't keep recreating things every year or every day. All these systems I'm talking about, Savesti, or for example, if you want to make a change, it's easy. You simply add, and there's continuity of Savesti. You don't disband and recreate. You simply add and keep moving. If Savesti can envision that you don't need to recreate things every time you want to make an update, why should it be hard for an organization to create templates, create frameworks, which are revised every month, every quarter, every year, and then updated every time you want to do a new report? I think it's good that all organizations document what they are doing, safeguard it, store it in an accessible place, make it available to all authorized persons, explain the processes to every staff who is concerned so that there's continuity within systems. It's bad for organizations to fail to sustain what they have put in place. And the problem of continuity affects very many organizations to a point that even when a head of department leaves for another job, systems crumble. In my work ethic, I've always ensured that there's continuity. I build teams, I train them, I develop teams around myself. I ensure that those around me become better than me, so that when I move on, they excel and do much more than I've done, than me being mean and leaving a system that crumbles behind me when I leave. That's a very important tip around human resource that I would leave for our listeners and our viewers.
And do you have any key resource or multiple resources, if you want, that you always rely on, that you want to share with our listeners? And a resource can be a book, it can be some guidelines, an article, anything, or even a tool, whatever you like.
Yes, so what I do self-teaching. No one teaches me what I know. I teach myself. How do I learn? There are many sources for learning. I'll give the obvious ones. Organizations that have been here for long. UN has been here since the World War time. World Vision and others. These guys have generated, and they have done it all. They have hired the best consultancies. They have had the best teams. They have had the best brains out there. Any organization which has been running, please visit the legendary organization websites. Look at their tools and learn from them. If you don't do that, you will think you know when you actually don't know. The best sources for me, number one, visit websites and resource centers for organizations that have been here since the World War started, like UN and others. They have been here for hundreds of years, and they have good data, they have good resources. The other source is when you are subscribed to the socials like LinkedIn, X, and other social media platforms. Every day, organizations are running their reports through there. Choose your top 5 organizations, follow them. Like me, I follow SurveyCTO because I want to read their latest publications and outlets. I follow Google Data Studio because I want to read about them. I follow Salesforce because I want to read about them. Follow Google and, choose your top 10 organizations whom you know have good materials. Follow them, keep reading their publications in addition to their websites. The other third source that I have is, I know there's a lot of AI. For example, ChatGPT has good materials and resources. If you use it wisely, they are able to do for you a lot of research in a short space of time. But also, I'm glad that every organization, including SurveyCTO, they are now incorporating AI capabilities within their tools. And anyone watching this podcast, I would encourage them, go and check out the SurveyCTO AI section. You may save minutes and days and hours and weeks in generating data collection tools or data points. These are materials that help you become efficient, but you also become different from others. You don't have to be proud from learning. Keep learning and keep improving. The last source I'll talk about is our governments publish a lot of data on different things. For example, in Uganda, the Uganda Bureau of Statistics. In Kenya, we have the Kenya Bureau of Statistics. In Tanzania, we have the Tanzania Bureau of Statistics. Every month, these guys publish on consumption, household income, prices, inflation. The central banks of every country publish data on interest rates, on very many variables. When you follow that data, you begin learning things you didn't know about the communities that we serve. For example, you're able to know the prices of commodities where you are running your NGO or your business. You're able to know the inflation levels where you're doing the business, but also you're able to know the poverty levels of where you are. I would encourage every person that is so passionate about data and all these tools that we're talking about to read those sources. But finally, Marta, we should interest ourselves in reading reports of organizations. I'll send people to the website of Nyaka. Go and check out their impact reports. Go and check out the impact report section of Raising the Village. Go to the human resource. Go to the websites of the Human Trafficking Institute. Look at the impact report which was published last month. Look at how the data is crafted. Look at how it's communicated. Look at the success stories there. Look at how they communicate, the diction of words used, the English, the flow, the creativity in writing. There are many sources that we can use. Map out organizations that are doing it well. But also, it's important to look at organizations which are progressing in terms of revenue mobilization every year. When I joined Raising the Village in 2016, we were dealing with a budget of 600,000. Today, when you look at their impact report or annual report, they are now doing 11 million per year. So in a space of 8 years, they have increased their revenues from 600,000 per year to 11 million per year. You should ask yourself, what are they doing different from me, who has been doing $1 million per year for the last 20 years? These are questions that cause us to keep digging. If they are doing impact reporting right, it means they are being found by donors and they are being funded by those donors. Ask yourself, what can I check out from Raising the Village that I can use to learn and transform my organization? Then ask yourself, who is behind this? Is it Paul? Is it Alex? Who is that guy that is doing this? Look out for him and engage him. And that's how things happen. And Marta, there's no better way I can tell someone really to look out for this content other than those 5 or 6 ways I've mentioned.
Perfect. So be curious and learn from others. I think that's the key takeaway. I think we'll be able to share some of these resources in the description of the podcast episode for those that want to check them out. So thank you so much, Paul. It was a pleasure to speak with you today.
Thank you. And Marta, as we close this, the professionals out there, my guys, my M&D guys, all the guys I'm mentoring, all the people that are listening to this podcast, please stay adaptable and always focus on the stories your data tells. The story is important. Learn how to integrate numbers with stories. Learn how to integrate numbers into the visuals. Get a good graphics guy who can always do for you the graphics that cut out. If you don't do good graphics, no one will read your work. Even if you have nice stories and you have nice numbers and you're able to blend these things together, your graphics guy can disappoint you. But when the report is nice and the graphics guy has brought it out nicely, everyone will say, hey, look at this report. Boardrooms will begin talking about you. It makes a lot of sense when boardrooms are discussing your impact report. I've had people sending us emails telling us, hey, your M&D team is buzzing. Could you please connect us to this team that is making wonders? It's up to the organization to connect you to them or leave them out due to competition. But what does it mean when boardrooms are talking about your work? It means you're doing a good job. Please look out work that makes boardrooms to speak. CEOs should talk about your work. Funders should discuss it and refer to it as best practices. If you can do that, then whatever you are doing in the background, just know it's making sense.
Thank you.
Survey and Beyond, the Data Collection Podcast, is brought to you by Survey CTO. To find out more about Survey CTO and how it ensures reliable, secure, and scalable data collection, visit www.surveycto.com. And make sure to search for Survey and Beyond the Data Collection podcast in Apple Podcasts, Spotify, Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at Survey CTO, thanks for listening.